everybody. Welcome to this week's episode of Ask an Expert. We are joined by the wonderful Dr. Michelle Correia-Jeffers, and she is coming here tonight to talk to us about physical therapy for riders. And we were just talking before this that she is both an expert in physical therapy for riders as well as horses. So she really has quite the wealth of knowledge, and a lot of the topics here, the questions that we have tonight, I'm sure will kind of branch between the two. And I mean, Dr. Correia, thank you so much for being here. We really appreciate it. And yeah, I hope that we can really get into this topic. But before we do so, can you give us a bit of a background on yourself and just, tell us where in the world you are and give us a bit more detail about your background.
Awesome. Thank you so much for the intro. I am Dr. Michelle Correia-Jeffers. That's obviously a mouthful, so I normally go by Dr. Michelle or Dr. Correia. I am currently located and practice in Portland, Oregon, but I also practice and have my license in Washington as well as Florida. And I am both a Doctor of Physical Therapy for human athlete and then have my Certified Equine Rehab Practitioner certification from University of Tennessee. So that's obviously a lot of information and education, but I basically got my undergrad degree in exercise science. I'm an eventer primarily, and so I fell in love with movement and kind of how strength training for the horse helps improve their movement. I learned that through the dressage portion of eventing and how horses with injuries can recover with specific modalities and specific strength training regimes under saddle. And so I thought that I wanted to go more into like the human anatomy physiology realm because my dad's actually a small animal vet in California. And so I grew up like in that vet hospital basically, and realized that very early on that I didn't want to do the blood, the guts, and all the gore. And so I decided to go more the like conservative management where I didn't necessarily have to do a lot of the like slice and dice and actual surgical component, but still help in the healthcare realm. So I went into like more of the physical therapy realm, got my undergrad bachelor's degree from Oregon State in exercise science and loved the anatomy portion, loved like the exercise and biomechanics, physiology components. So I went into physical therapy as kind of a natural transition from that to help learn about how exercise can heal injuries. And then when I was in my PT program, I went to Creighton University, which is in Omaha, Nebraska. So I've been kind of all over. I was in my doctorate program there, and one of the professors there did a lot of canine rehab and had started branching out into the equine realm as well. And so he's like, you can do this for horses too. And it like blew my mind. I was like, that makes so much sense to be able to do it for both. And like, I grew up with a lot of that rehab directed by the veterinarian, and that wasn't really a discussion of having like a rehab professional. And so when I ended up going through that education, like it just made so much sense to see in the sport how to work with both movement chains. And so now it's like when I practice, it's like basically unraveling like a big onion, because I get to watch the humans' mechanics, the horses' mechanics, put them together, see who's driving the issue, or are they both having separate issues that don't help each other. So it's super fun.
That is, yeah, I totally understand. I mean, that the path that got you here makes perfect sense. And like, I think that what your expertise is so interesting. Like, and you must just have such a wealth of knowledge about both the horse and the rider and kind of how they're working well together and how they're like not working well together. It's really interesting.
Yep.
So can you, so one of our members, Anna, she says she is a DPT who has often thought about getting her, is it CERP or CERP?
Yep.
Is that?
Which is the Certified Equine Rehab Practitioner. There's also a CERT, which is CERT. So
they really like to confuse us with all these acronyms, and you never know if you should like say the letters or say it as the word. It's like, okay, her CERP.
You're good.
She was like, I can't wait to hear about your career journey. She's asking, what was it like taking the CERP course as a human practitioner, and how did you develop your business? And then she's like, I know referrals are necessary, but do you have clinics that you partner with? What's a high and what's a low of being an equine PT? That's a lot of questions. So if you want me to like repeat any of those, start with what was it like taking the CERP course as a human practitioner?
Yeah, so the equine rehab course through University of Tennessee is one of two programs in the U.S. that allow PTs to work with equine athletes, and so it's a program that's open to veterinarians as well as physical therapists. So you get to basically learn alongside veterinarians, which I think is a really cool like marriage of our education because in vet med they don't learn as much about the rehab modalities, and a lot of that is experience based. And I think it's evolving too. The more that we are demanding more rehab education, I think that is falling into some of the vet programming. But they are basically taking this program to learn more about the modalities and exercise prescription, which the human PTs have a lot of that background, but we don't have as much of the equine anatomy. And so it was really cool because we had um, like you have a week or a little bit more of a week of lab work in person that they paired up the PTs and the vets on our uh, dissection horse. And we got to like go side by side, which was so cool because like all of these veterinarians, in a lot of cases, are surgeons, and so they're very skilled with a scalpel. And I've done a lot of like human cadaver dissection, and to have like our strengths from like the anatomy perspective in that capacity to translate over to like talking next to like these surgeons who are very used to doing some of the surgical components was super fascinating. And so we get to like chat with each other in labs about where we see the benefit of rehab programming going and where that collaboration can happen. And so what I think is like kind of the peak of why it's an important component for my personal practice is when I was initially starting and treating riders, I kept having these cases that were kind of funky where the rider would have pain often in saddle. And like, for example, I have this rider early in my career that had hip pain in saddle early on. It happened in trot and canter, and it was pretty consistent. And so I typically start my evaluations off horse and see where the joints above and below the area of concern is. I basically want to look at their strength, their range of motion, and everything looked pretty good on that rider. And then I put her in the saddle and watched her ride, and the mechanics of her hip totally changed. The way that her hip moved, the way that her low back moved. And it kind of came out of left field because her normally I would expect her to have some movement impairment on the ground that I would have been able to find. And so it got me like kind of thinking clinically early in my career when I was working with riders to be like, okay, well, what are the other factors that can be impacted here? We could have saddle, stirrups, the way that they've learned to ride, and or the horse. And so then you kind of to me it made sense to evolve the rest of that movement system to see, does the horse have actually like a sticky stifle on the opposite side, and they're like shifting the pelvis of the rider like slightly, but in a way that you can't really recreate on the ground. So having both the off horse and the on horse assessment to me was really vital. And then I could kind of, when I got the equine rehab education, then I could kind of evolve that, to be able to say, okay, is the horse actually what needs to be treated to fix the rider's hip? Which sounds it sounds crazy, but it does happen. And I have the same thing happen vice versa, where like a horse has low back pain. We change some of the mechanics of the rider, changes the horse.
Wow. I mean, yeah, it once you think about it, like you explained it that way, it makes perfect
Yeah.
sense. So when people hire you,
hmm
they're hiring you to analyze both them and their horse. Is that
So I can do both. I often work a lot with pairs, but I will treat riders and then I will also treat horses. So I will treat them. I think of it in kind of two different categories, regardless of if it's horse or human. I treat like an acute injury, so something is actively painful, or they have maybe a surgery, or they have some sort of pathology that we're trying to prevent or are concerned about, or I'm doing like a performance assessment. So horse or human is moving well, they want to keep moving well. And so from either perspective, I treat horse or human or both. And obviously, if I treat both, that kind of helps the whole system move more, in a more productive way. But I often will get referrals for the horse, or I will treat the riders. And that's kind of to go with, I think part of the question too is about how that works with like the referrals. And I actually get, so I have, because of my PT degree. So I'm allowed to treat riders directly. So I don't need a referral to treat the human. And that's kind of the beauty of that degree, is the Doctorate of Physical Therapy has evolved so that PTs can see human athletes immediately. So you sprain your ankle, you can go into an urgent care, they can x-ray it, they can say you just sprained it, and they can send you to a PT. So you still have that cost. Or kind of the model of healthcare that's moving now is to be able to save that cost, send you directly to the PT. The PT's educated to say, actually, I think you need an x-ray. And so they can send you if appropriate. But for the equine athlete, obviously, the education from the physical therapist perspective, we don't have a ton of differential diagnosis. So like if your horse has stifle pain, I can treat stifle mechanical changes, but I also don't have an x-ray unit. I don't have the systemic knowledge that a veterinarian does. And so we need to have a veterinarian on board to refer. And that often looks like the vet giving a thumbs up saying, you can treat this horse. This is the pathology, or this is the history. We're not dealing with anything acute. Or this is something that we need addressed. Can you send a program for X, Y, and Z? And so I can typically treat horses easily with referral from a veterinarian, and just it's fostering those relationships that is both rewarding and can be challenging too, to foster those relationships so that the veterinarian knows that you're going to work collaboratively with them and not necessarily like ignore their recommendations. Like the goal of having a physical therapist that's trained in equine rehab is to have a professional that has been specifically trained and tailored in exercise conditioning. And I think that's been a gap in our sport for a long time, because we've had body workers and trainers and kind of the gray area of rehab. And it's not to say that those providers or those individuals can't do successful rehab, but this is to help our veterinarians have a clear picture of who they can send things to that have that education. And I think that's going to help with our like eventual and current like vet shortage that we're dealing with. Like your vet is having to be all of the things. And so having someone that can help with the rehab component that's educated and has been trained through vet programs can really help.
Yeah, I can imagine. I mean, that it makes perfect sense. And I think it's a really important role to have on your team as you support yourself as a rider, but also your horse.
Yeah,
Because there's two athletes that need to be supported here.
exactly.
And it's really cool that you can do both. So kind of on that topic, understanding the rider as an athlete.
Yes.
What are some common physical issues or injuries that equestrian athletes face?
Ooh, that is a great question. That can involve a lot of conversations. Riders are unique athletes in many capacities, and I think that we are starting to see the change of riders starting to address themselves as athletes, because I think for so long we considered the riding component as the fitness part of it. And if you compared that to like soccer, a soccer player playing soccer, the game is only part of the process. They're also conditioning off the horse to get stronger for the soccer game. That's something that I think is going to be very important as we elevate our sport for riders, because in riding we are typically moving in certain patterns, and I think of that as like very forward and back motions. We're not doing a ton of lateral motion, so you're not like cutting to hit a ball like you would in soccer. In riding, you're typically going forward, or you're asking your horse to back. You're typically doing some sort of like lateral work for a lot of people that are doing more dressage based movements, but you're still moving forward. And so there's not a lot of lateral component to the sport. And so if you're not training any sort of lateral motion outside of riding, that is an area that tends to be weaker for riders. And that weakness can create some imbalances and or potentials for injuries. And so that's something that I often recommend for riders is doing things like single leg balance work or strength training with single leg, or doing any sort of like lateral base motion. So you're getting the outside of your hips and not just your glutes and your hip flexors, because those are often used more frequently when we ride. So I definitely think hip stability in general is really key. I think a lot of riders also, from my experience, have had a lot of mid back stiffness. And I don't entirely know if that is specific to the riding or if it's specific to how physically demanding being a rider is, like just at baseline, the like lifestyle part of it, the you're moving wheelbarrows, the you're moving saddles, you're picking out their stall. It's a lot of like upper body and rotational motion that can lead to some stiffness. And so for me, a lot of times I'm looking at the hip for strength laterally. And then I'm also looking at the mid back for if it's stiff, painful, uncomfortable, because that will, if you look at the human body, you have your mid back, which goes to your lower back, which goes to your pelvis. So if your pelvis is involved and your mid back is stiff, then that's going to create a chain pack factor to potentially the middle or the lower back. And so for a long time, we can go with these kind of altered or asymmetries in our body, but there's also a factor of how can we prevent it from becoming a painful area, or how do we prevent ourselves from having to deal with stiffness throughout our day. So there's a lot of mid back mobility that is typically needed for riders, as well as hip strength, but not necessarily forward back hip strength, the side to side stuff.
Got it. And so Erica asked, she asked, what do amateurs not work on that we should? Would you say it's those two things, like kind of the like hip and back mobility and strength?
Yeah, I think hip strength is huge for riders, and then back mobility. So getting that range of motion of the spine in all directions um, is really key. Those are probably top two things that I think about with riders. If I'm looking at a blanket rider, we're not talking about discipline, we're not talking about like experience level. Those are things that I look at pretty readily. I think that the other thing I would add to that, so if we're talking about what amateurs are not necessarily currently doing, I think a big component of that is um, also making sure that riders are understanding the importance of off horse strengthening. So being able to have a regular fitness routine that fits into their life and their schedule that adds to what they're doing for their horse. So regardless of if we have an injury we're recovering from, or we are dealing with, you know, trying to manage and improve their riding, those are still things that will improve with baseline fitness strengthening, so that we can add to the things we're doing in the saddle. Because again, I think we often think about riding itself as the act and fitness, the thing that's going to keep us fit. But if we can add a baseline fitness to that, your riding really improves and some of those asymmetries can go away.
Got it. And so strength training is something that I think we're moving more towards as
Yes.
equestrian athletes, which is I think is great. It's a great evolution. What about, I think maybe this is just me, but I don't think it is just me. What about flexibility? Like I feel like as a group, we don't do a lot of stretching. How
Yes.
important is stretching in this whole equation?
So that's a great question. There's a lot of um, research in human medicine about stretching and the type of stretching and what stretching is actually like physically doing from a physiologic component. And what I have found to be the most, I find that oftentimes for riders, because they feel really stiff, they want to shift to doing some stretching, which is not necessarily incorrect. I would argue that you might feel stiff because you are not strong enough. And so those muscles or those joints get stiffened up. And so it's kind of a balance of we want to make sure that your joints, specifically that your joints have the appropriate range of motion. If they don't have the appropriate range of motion, that's when you need to reach out to a PT or healthcare professional and say, hey, this joint is really stiff and it hurts, or it's really stiff and it doesn't feel good, or it just doesn't move as symmetrically as my other one, like that can rule out some things. If we have appropriate range of motion, then I typically err on the side of having a strength program followed by some stretching. Most of the research shows that if you're doing stretching, like the typical like hamstring stretch where you have your leg in front of you and you're holding there for 30 seconds to a minute, there's actually a reduction of your power output of the muscle. So we typically have erred away from stretching before working out or before riding, but instead doing, you can still do that hamstring stretch position, but just go into it for 2-3 seconds and then come out. And so doing it more in a dynamic sense. If you have some muscle that really feels consistently tight, that can be helpful to have a little bit of dynamic stretching before the activity you're planning to do, but then spending some time at the very end of your workout or ride. That's when you can do those more prolonged stretches. But I think that a lot of times we think of that tension sensation as meaning that your muscle itself is really tight. But I would encourage you to dig deeper into what that actually means. Is that muscle creating a joint restriction? Is that joint no longer moving appropriately? Is it related to a soft tissue injury that has been hiding and lingering and you've kind of had to put a Band-Aid on it? Or is that tension because that muscle has had to do more work than it's ready to do? And so therefore it's just giving you input that says it's not happy doing the job because it's doing too much. So that's where like that strength component can actually help.
That totally makes sense. So how does your approach to physical therapy differ between equestrian athletes and just like athletes of other sports? Is it like is there a huge difference in the way that you're approaching them, or is there not?
I mean, so I've treated across variety of sports, variety of levels of sports, and now I'm pretty like sport specific for equestrians. Early in my career, I worked with more general population and with sport specific athletes of more traditional based sports. And I think what I've learned from the more traditional based sports is that they have way more musculoskeletal support than we do as riders. And so if you think of our soccer athlete, most kids who play soccer typically are used to having some form of a coach, typically an athletic trainer. If they're in high school or college playing soccer, they typically have access to a physical therapist. They typically have access to a strength coach. And so those athletes are more, they understand, that kind of collaborative care perspective. And so they're used to having someone. I think equestrians, and one myself, like I grew up riding and competing and not really seeing any sort of healthcare professional on grounds. Like we would be at shows, and when I first started eventing, like you had to wear your, like all of your information on your little like wristband or your armband so that you were identified. And so that to me, like the fact that we have been in a sport that has such a high risk and can be dangerous, and it doesn't have very much musculoskeletal support. You don't have a physician on grounds. Typically, you have an EMT, so there's that. But I don't often see, even in today's day, like I don't often see like concussion screening being done often. In traditional sports like football, there's concussion screening multiple times a year. In the beginning of the year, they typically take an exam, like a cognitive exam, a balance-based exam, where those athletes are all screened. And then if they have a concussion midway through the season, they have to still test to that same level on that cognitive test in order to get back to sport. For us as riders, that's not really something that's normalized. And so it's not utilized. Our sports medicine is not utilized to the degree that it could be. And so it feels really like it's not accessible for a lot of riders. So for me, I feel like I tend to work more triage than anything for riders, because I'm making sure that like we are screening for concussions if there is a concern. Are we making sure that this finger is not actually broken when you fell off your horse and it got caught in your reins? Like, do we actually need to get an x-ray of this? And so I feel like I have taken on a role in physical therapy, which is more of that direct access kind of triage, like, okay, who do we need to send you to? Because we're not used to having a lot of professionals here that you're used to seeing. And so I find that a lot of my work is helping to navigate that a little bit more for riders, so that they can really improve their own health, but also so they don't have to jump through the hoops of healthcare, given that they aren't used to having as much support. So
Yeah, absolutely. It's been really interesting just like through the process of creating Ride IQ and talking to all these like really high level coaches and just learning how much, I mean, even at the lower levels too, like the emphasis on the equine athlete is like, I
mhm.
mean, is paramount, but people kind of just like forget the rider is also an athlete and like going through all of these things too. And our bodies are needing to be kind of supported in the same way that the horses is. So I
Yeah,
think the work that you're doing is so important.
it's interesting
Um,
because a lot of the like it's such a physical lifestyle that if we're not necessarily taking care of our body, like taking care of our body helps us ride better, but it also helps us do all of the other things like packing up a trailer to go to a show. Like that's
mhm.
physically demanding for your body. And like I don't necessarily think you need to go do a 2-hour strength training situation after that. You just did a 2-hour strength training situation when you're loading your trailer. But I think the more that we start treating our own bodies as athletes and start seeing what other sports have been doing for decades and kind of mirroring it to a degree so that we can have better health for our own bodies and our own brains, it will really help prevent quite a bit of the like everyday wear and tear, the irritation in the body, and help maximize our athletes for sport. Because even our like Olympic athletes are not necessarily like if you're looking at Olympic athlete ages, like a lot of that is based on experience and time spent in the sport. And so you're not seeing the 16 or 17-year-old gymnast athlete. We're seeing more 30s, 40s, 50s athlete. And so we need to make sure that those athletes are also being taken care of to the same level.
Yeah, yeah, absolutely. So kind of on that topic, if we switch over to a bit of like injury prevention, what strategies do you recommend for preventing injuries in equestrian athletes?
Ooh, the injury prevention conversation is something that I really like because um, I feel like a lot of riders aren't necessarily doing things yet. So there's a lot of things we can do. I think one of the biggest components of injury prevention across the board, regardless of sport, is actually sleep. Is making sure that you are getting quality sleep, like 7 to 9 hours, depending on your body, depending on what your circadian rhythm is. But sleep is actually huge for injury prevention. Um, Hydration status is also like a huge component of that, as well as um, regular appropriate food. So making sure that you are not just having coffee before you go ride, like making sure that you are eating as your body would need fuel going into a sport in a sporting event. So those are like 3 unexpected things that you can do to help prevent injury, but it's huge, like sleep, making sure that you are eating appropriately and enough food to go out and ride, and then being able to make sure that you are hydrated. From a physical perspective, I would recommend like having more of that lateral motion for your hip strengthening and the off horse training. So having a baseline of strength training is actually really helpful for reducing injury. And then making sure that you have some like some semblance of recovery post ride. Oftentimes, if you think of eventing, for example, um, if you think of when a horse is done with cross country, they're typically walked, they're typically iced, they're typically like given some electrolytes, they're typically like put in a little cushy stall, made sure that they're feeling comfortable before their next day, they're typically stretched. And that's like all being done by the rider that's ridden the cross country course and then also doing all of that. So I think of if you can take like ice your horse, stretch while you're icing your horse, or make sure that you're doing some sort of like yoga poses or some gentle mobility, things that are not really physically taxing on your body, but making sure that you're like stretching your body post physical activity, like post cross country or post show jumping rounds, so that you are giving yourself a little bit of TLC in your own body. That can go actually quite a long way.
And you had mentioned hydration was like one of your top 3 things.
Yeah.
Is that just water? Are you somebody who preaches electrolytes are like really important? I never know, like should I be doing electrolytes? Is that an important thing for us to be doing?
Um, the electrolyte topic is like really, there's a lot of people who are like weirdly involved in the conversation about electrolytes, and I think we also get a lot of information from social media these days that's like everyone has an electrolyte like brand ambassador, which is funny to think about. But most of the time, if you are drinking regular water, you're typically looking at you're typically looking at your hydration status based on your urine color. And so you want it to be like not a really dark color. And you also don't need it to be completely clear. So I typically recommend, if you are concerned about like hydration status, or you maybe have some health conditions that you need to be concerned about, if you are concerned about having hydration or having electrolytes, like people that have more of a sensitivity to salt have to be kind of careful about how much electrolyte they have, because it's essentially it's salt, or often sugars. And so I typically recommend talking to like a nutritionist or dietitian about that if you have like a medical history with that. But for the most part, I'm typically looking at shows. If we're in a hot, like physically demanding environment where we are doing a lot of showing, where we're either doing show jumping or dressage several rounds, or we're doing eventing, then having a high sugar electrolyte, a Gatorade, and I'm talking like not sugar free. The goal of an electrolyte based drink is that you have sugars in it. And so to me, the sugar free Gatorade doesn't necessarily cut it because it doesn't have sugar. So you have to have the like regular sugared Gatorade, but then making sure that you're also having regular water on top of that. So if you just have like a regular Gatorade drink, you can often get that much of like an increase in your salt, but you also want to make sure you're giving it more water. So my like personal kind of rule of thumb is that if I'm doing a Gatorade, I want to do another water of the same size.
Got it. Or maybe
So
like
enjoy your
dilute the
electrolyte.
Gatorade.
That's fine.
Yeah. I know. I like it keeps like getting targeted with all these electrolytes, and I'm like, do I need to be doing this? Like, I never know. So that is really, really helpful. Okay, so can you share, are there any like absolute knots of recovering from an injury? Are there specific examples that are things that might set someone back or prevent a full recovery that should be taken seriously?
Ooh, I have a perfect example for that, because I recovered from an injury like 3 years ago now. And I almost tried to recover faster than I should have. And I am a medical professional who knows better. And I like should have listened. But so for example, there are a lot of injuries that can be like gradually returned to sport appropriately. The problem with injury in traditional medicine is that oftentimes we'll go back to our soccer athlete, if a soccer athlete goes into a physician or an orthopedic surgeon and they are following them for an ankle sprain, there is a timeline that we know when that athlete should be able to introduce specific quick motions. When should they start running? There's literally timelines dependent on their type of injury. And we know the drills that they should be doing, the drills they should not be doing. And that's for youth, that's for college, that's for professional, that's for recreational. So there's like, when we're talking traditional sports, there's a lot of really good material and information that can be utilized so that healthcare providers of all levels, can be able to safely return an athlete to sport. That does not really exist for equestrians. And so a lot of times providers can't really say, okay, you can sit on your horse, you can do walk. Maybe you can start doing trot in X amount of weeks. Or maybe if you have an ankle sprain, you can start flat work, but not start jumping. Because there aren't as many research articles being depicted specifically to riders, there's not really a protocol for it. And so that is where it's helpful to work with a professional that's more geared towards that sports specialty. Um, and for example, I broke my right radius and ulna, so my right forearm, both bones, falling off a horse in 2020, like a week before shutdown. I had surgery. They put like 9 pins and a plate in it. I was in the middle of practicing too, so I had like a regular in clinic outpatient orthopedic job that's very hands on. And then of course the world shut down and et cetera, 2020. So I had like I was actually allotted like my work had me like shifted out of that job and paused because of COVID. And so I actually like unintentionally ended up with like a break, which was great because I was healing. But my orthopedic surgeon who did the surgery, I saw her like 2 weeks post-op. So I have like a bunch of hardware in my arm. And I know the timeline is typically 3 months post fracture of any kind before you can do anything of impact. And I had a mare at the time that I was working with. And so I go into my appointment and I'm like, okay, so I know that I'm 2 weeks out and I know that it's my right hand, but can I like lead my horse out of her stall and like lunge her with my left hand? Can I lunge her with my left hand? I'm not going to clean her feet. I know that's a lot. I can brush her though. And thankfully, my orthopedic surgeon had worked with enough riders. And she was like, well, that's your right hand. That's your dominant hand. If that horse does anything stupid or silly, the minute that you walk out of that aisle or bring her out of a stall and you have your hand on a lead, that's your automatic arm that you're going to grab it with. I was like, you are correct. That is probably what I'm going to do. And so thankfully, like she gave me the information to be like, no, you cannot do that. I know you want to, but you cannot lead the horse out. So I spent 12 long weeks not handling my horse with any sort of lead of any kind. But I would like brush her in her stall. And there's things you can do, but there's certainly injuries that you want to make sure that, like when you fracture something or have surgery, that you want to make sure that you're not going into things too quickly, just because that probably wouldn't have totally like it would not have created any problems with my hardware that I had in there, but it would have likely prolonged my recovery if I did anything unexpected with that hand. And so I think having and working with a professional that knows how horseback riders want to get back more than anything, but also that we need like rigid expectations of like, this is your timeline, this is when we're sticking to it, that's when you can do X, Y, and Z. And knowing that you might have to adjust that plan like with the professional by being like able to educate them a little bit more. I'm sorry, there's a leaf blower outside as someone's walking by with a leaf
No worries.
So if you hear that, apologies.
All good.
But yeah, I think that being able to collaborate with a provider that knows or is open to discussing how to return an athlete to sport is huge. I have a physician up here that works primarily is a sports specialist physician and primarily works with concussions. And he's worked with quite a few riders, and I've referred clients to him because he will be able to tell a rider, okay, this is when you're recovering from this grade of concussion, or this is how long you've been dealing with symptoms. This is where we should be returning you to walk trot. This is when we return you to walk trot canter. This is when we start over fences. And that type of information I think is really vital for riders, because if they go into a provider and the provider says, I don't know, or doesn't say when they should return back, that's when the rider's typically going to try it for themselves. And that's not always the safest thing.
Yeah, I mean, that's been my experience, like with everybody in my network who I know is coming back from an injury. It's like a free for all. It's like, let me just see how I feel. And it's like, that is not probably the right way to be going about this. But I think getting more educated providers on equestrian, like athletes, like what each thing entails, I think is a great way for us to be moving. So,
and I think asking your providers to like try and get a little bit more information too. Not that you like demand from them, but like I've worked with athletes that have done like archery. Like that's not a very traditional sport, but I've worked with athletes that have done archery, and I asked a lot of questions of my patients to be like, what are the specific things that you have to be back to so that I could give them the best information. Yes, if there's an archery specific this PT, like that would be ideal for them. But if they're coming to me and I'm able to get the most information about like their sport to get them back, that can be done really successfully with a lot of education on their part. So I also think like having the providers that are open to kind of learning about how they can get like getting the athlete back and what they actually need to do. Because oftentimes we think of being back on the horse as walk, trot, canter, and jumping if we're jumping, as that's your first ride back, is that you should be able to do walk, trot, canter, jump. And that's not always, like, sometimes we need a little bit more graded exposure to it where we're starting walk, trot, and we're starting walk, trot, canter, dependent on the injury.
Yeah, absolutely. Okay, so that's kind of the injury prevention. There's probably more for us to ask on injury prevention, but I want to get to some performance enhancement before, and we can always go back to it. How are there like? So Debbie is asking about yoga and whether, I know you kind of touched on yoga. You mentioned it earlier, but is yoga something that you like? Is something that you don't like? What do you think about yoga for riders?
I'm all for yoga. I'm all for whatever type of movement helps people have some off horse practice or movements. Like you think about, I've been preaching about the like lateral hip strength. There's a lot of movements in yoga that are also it's a lot of variations of positions of the body and lots of like stretching and range of motion. And those are all lovely things. I typically encourage, if there's some semblance of a yoga or a Pilates or a low impact option for riders, that can be really helpful. A lot of times I think people get overwhelmed with like the type or the kinds of workouts or fitness things they quote unquote have to do. And so it can feel really overwhelming, and that itself can feel like a barrier of like, I can't even go to the gym because I know that if I go to the gym, I have to figure out what I'm doing. And then from there, I have to figure out, is it a strength day? Is it an endurance day? Is it a cardio day? Is it a yoga day? And that can be really overwhelming for a lot of riders because we're not used to having like an off horse practice for many people. And so that's where having some guidance from like an equestrian strength coach, an equestrian PT, or someone who can work in that fitness realm to say, these are like good options for you, for your body, and making sure that you're able to progress, but then maybe adding a little bit of yoga or a little bit of cardio. I typically encourage riders that if you have a fitness practice that is something that you're able to regularly implement, like that's the best exercise for you. It's the exercise that's quote unquote best for you is the one that you will actually do. So yes, I can say like strength training with a kettlebell is great strength training for some people, and it will increase your strength. But if it's not a type of exercise that's enjoyable, then you're not necessarily going to do it. So the biggest thing about fitness is consistency. So if someone is doing yoga and able to have a regular practice, I'm all for that. I would say if we are dealing with something like osteoporosis or dealing with some sort of bony changes that we want to increase impact, then adding things like strength training can be helpful. But I wouldn't necessarily jump that way unless we needed something.
Yeah, absolutely. Debbie is also asking, do you have kind of the most useful exercises or poses for hip flexibility? Or she said 5 most useful exercises in general, if you want to do that instead of hip flexibility, but whichever one.
5 exercises that are the most common. So we typically, if we're talking about, was she asking for hips specifically?
She said hip flexibility, and then she said or in general. If we want to start, maybe a couple that are related to hip flexibility.
Yeah, totally. I have a lot of options. So I'm like, ooh, okay, how do I want to do it? So I think one of the motions that I really like for hip flexibility is making sure, first and foremost, that the hip has appropriate range of motion. So if we're talking flexibility, we're typically talking about the joint range of motion versus the muscle flexibility. So if we're talking joint mobility, then I typically like to have some semblance of range of motion for the hip, like a squat is really helpful, especially for riders, like a regular squat. But I think about it, and you can even kind of do this assessment on your own by having, when you do a regular squat, thinking about, do your knees go far forward? Do your hips go far back? Because a lot of times riders will squat, but they'll be more like knee dominant. Let me see if I can set my video up so I can explain it, because it's kind of tricky to word or to like articulate it without moving. So if you, let me move this down. If we're talking about like a squat, so there's a couple different ways that you can squat where people will go like more knee dominant, where they're bending the knees more than they're actually bending their hips, or people will squat with their hips moving more than their knees. So like their knee doesn't move at all. So I think of being able to do both knees and hips coming all the way down and coming all the way up, as both of my knees cracked. Did you hear that? So being able to bend both knees and hips. I like that motion itself because it does kind of address both hips and knees. And it's a great, like, almost like a self-check on like, are you more knee dominant? Are you more hip dominant? So you can kind of focus on getting range and depth in your squat by getting more knee range of motion and more hip range of motion. So squat is like up there on my top of my list for strength and more mobility because you're able to vary it so much. Like, do you add weight? Do you try to go for like depth of squat? So there's a lot of things you can do with that. You can even do like wall sits if you want like endurance. So that's a really variable exercise for hips and the muscles surrounding it. I think with trying to think specific for like lateral hip strength that I like single leg balance work where you're either doing like a lunge to a march can be really helpful because you're adding that like balance component on one leg and you're also adding that like depth to your single leg lunge. So think of like a regular walking lunge and then bringing one knee up towards your chest. So you're standing on one leg. I like that one too for hip stability.
Super helpful. One thing I haven't tried, but I've seen is like the where you sit down with your legs like fully out and you lift your legs over like a dumbbell or something. Is something that you like?
Yeah, so that's working your hip flexor. I think we often see a lot of information, and I would consider it almost a little bit of misinformation about the hip flexor. I like that exercise. So you are on whatever social media algorithm you are on is correct. But a lot of times, riders consider themselves to have really tight front of their hips, so like really tight hip flexors. I would argue that they're not always tight. They might just be weak. And so like tension, we kind of talked about this earlier, tension or like having that tightness is not always an indicator of shortening of the muscle. It can actually be that muscle is working extra more than it should. And so you can get that like hip tension feeling in a hip that is weak. And so doing the like laying, I typically like to have my athletes like sit on the ground, have their back like supported by a wall and their legs are out in front of them. They're going to think nice and tall and activating their core and then bringing one leg up and out to the side almost to like a 45-degree angle. And then from the 45-degree angle back. And the key is keeping the knee extended completely. So when you're lifting, you're stabilizing with your quad and your hip flexor. And you can like lift it. Sometimes I'll have people lift it over like a yoga block or like a small like kettlebell where you're able to just lift it a little bit and then you can like work that up. But I really like that one. It's surprising how many people can have a really hard time with that think that they have tight hip flexors and it ends up being more of a weakness.
Yeah, totally. Okay, so Taylor is asking, what are your suggestions for improving riding position or posture after having kids? She's currently and still struggling with core engagement after 3 kids, and her youngest is 2. So, I mean, Taylor, you're a super woman for even even
Yes.
being where you are. So don't be so hard on yourself. But yes, what are some tips that you have for rider position and posture?
Rider position and posture is something that I work on all the time with riders, especially from like a performance standpoint. So if the rider is feeling good overall, but has trouble maintaining positions, then I typically see, okay, is it always going? I would almost dive a little bit deeper and see if for this rider, is it more difficult going one direction versus the other? Like, are they having trouble keeping their position when they turn to the right versus the left? I typically try to think of for riders in like more of an English based saddle, being able to sit and find your hip bones and like the seat bones of your pelvis, and being able to find if you can actually find both of those and able to push them into the saddle. So when you're sitting, either you're like static, your horse is standing, can you actually shift one pelvis bone down, come back up and shift the other one? Does it feel symmetrical to you? Or is it harder to do one side or the other? If it's harder, then we're typically looking more at like a pelvis asymmetry. So where we're not necessarily as aware of your pelvis positioning. So maybe you're going around your turns and it feels like you're straight, but one hip bone is down because that's how it always has been. Versus you go the other direction and that hip bone is up, so it feels better. So I typically start with some of that assessment with finding your seat bones and then finding like where your shoulders are in relation to your pelvis. Are you more shifted a little bit to the right? Are you shifted a little bit to the left? Or if you had a line from like your sternum all the way down to your hip and your pelvis that goes like along your belly button line, is that a straight line or is it a little curved? And a lot of that instability does come from the core and the pelvic floor being able to maintain a consistent pressure, which can be tricky post kids because depending on the type of birth that they had and the type of recovery that person had, it can create different types of asymmetries from baseline. Um, and so I typically, when we look at human athletes from a PT perspective, we're typically looking at like the way that their foot falls on the ground, the way that that footfall impacts their knee, impacts their hip, and trying to adjust gait that way. If we're looking at a rider, most of the contact happens from the pelvis because of the way that the pelvis sits on the saddle. So sometimes I'll see riders that have ankle asymmetries or ankle imbalances that create an issue. But a lot of times the asymmetry I find comes from the pelvis or the upper back by being shifted one direction or the other. So I would think of improving symmetry by finding your seat bones, making sure that they are able to make contact with the saddle evenly. So not only can you like push one down, but can you maintain the same like level of pelvis height? Um, and then to see if the shoulders are above the pelvis in that kind of straight line. Like you should be able to like zip up. If you thought about like your pant zipper, if you had a whole zipper that went up to your sternum, so that that line of your abdominals is able to be engaged. So I would start with that, more to evolve with that for sure.
Yeah, really helpful. Um, okay, I mean, we are here. We're like getting close to the end of the hour. So I want to make sure that I get a couple of these other questions that we received in, which might
I'll
be
be quick. I'll try to keep it.
no. Definitely don't have to be quick. I might just jump around on topic here quick a little bit.
You're fine.
Okay, so Grace is saying she just tore her calf muscle playing soccer. Are there
Oh,
exercises? That sounds really painful. Are there exercises that she should do with her physical therapist to support her riding? So far, she's back to being in the saddle for about 45 minutes with no pain, just tightness.
ooh, I have so many more questions than that. So I have a lot of questions to evolve with that. Is that walk, trot, canter over fences pain free? Is it just sitting, walking pain free? Are your stirrups the same level? Um, are they shorter or longer than they're used to? Um, uh, that's a hard question to answer on without that context. But I would say that, so calf muscles can be challenging for riders because you kind of have to have that elongated calf all the time when you ride. And so if you have an injury typically to the calf muscle, again, I have more questions like, was it a full tear? Was it a partial tear? Did your Achilles rupture? I'm assuming not if we're already back riding. So I'm going to say it wasn't fully torn. But that tissue, the soft tissue of the calf, typically has to elongate for you to be able to be in like a deep stirrup position to where you have your heels down. And so typically, if we are doing well in saddle, we're probably doing off the horse exercises of some kind and being able to incorporate that, like what we call dorsiflexion, but when your toes come up and your heel is able to go down, being able to increase that range of motion is going to be key for her. And that kind of goes across the board, whether it was like, 2 weeks ago or 12 months ago, like that range of motion is something that would need to be managed and maintained. Probably not forever. That tissue will probably heal appropriately, but I would just make sure that you're getting the range of motion of the ankle back. Sounds like that's a pretty good trajectory though. If I'm going to imagine we're walk, trot, canter in saddle.
For 45 minutes, yeah, I think she would have clarified if it was just walking. That's amazing.
That's awesome.
Yeah. Okay. So, I mean, we're here at the end, but before we do kind of conclude this, one, thank you so much for sharing your expertise. Like, this has been so interesting. Two, are there any things, like any parting words, like any things that you haven't mentioned related to just like the overall longevity and well-being of an equestrian athlete that we haven't covered here that you think we should cover? I just want to make sure to give you kind of the floor in case that is the case.
No, we talked about a lot of things, which is great. I think the biggest takeaway that I want riders to think about is to start thinking about themselves as an athlete and being able to address their body and their body's maintenance and care with as much consideration as you do for your horse, because it not only affects your body, but it will affect your horse. And we can improve both of the horse and human athlete perspective by improving our own well-being. And I encourage riders to make sure that they are prioritizing their health nearly, if not as much as their horse. Because I know we want to encourage our horses to be as comfortable as athletes as possible, especially in, this setup and the jobs that they have. But we also need to do our due diligence for our own bodies.
Oops, sorry, clicked the wrong thing. Yes, absolutely. That's a great point to end on. Everyone needs to take care of themselves. And I think we all, it's just going to be something that we all are always all working on is trying to find better ways to support our strength and longevity as people and athletes, and people like you really do help with that. So thank you for everything that you do. Where can people find you on social media? If people want to work with you, how does that all work?
Yeah. So if you are interested and want to work with me for like a strength conditioning component, I absolutely have some fitness regime options for riders. I also do distance consults for athletes in Florida, Washington, and Oregon. Well, Oregon, I'm here, so I often do in-person stuff more frequently for Oregon and Washington, but happy to set up some consult options as people have inquiries or needs. So my Instagram is StableBodyPT at StableBodyPT. I also have an email, which is my first, Michelle.Correia at StableBodyPT. And so I can list that as well for you guys to post if you have anyone who has further questions. And yeah, feel free to reach out if you have questions.
Wonderful. Well, thank you so much, Dr. Correia. This has been really insightful, and we really appreciate you taking the time. And thank you, everybody, for tuning in. And we'll be back next week with more Ask an Expert.
Thank you.
Have a good night, everyone.